Welcome. This is an Iowa Online Nurse Residency Program Resident Spotlight with Program Coordinator Jessi Grote. Today's guest is RN Alison Kramar from Upland Hills Health in Wisconsin. Alison completed the IONRP in March 2022.
Hello and welcome. We have with us today Alison. Super excited to have this conversation. She's been a great resident for us a couple years ago. So Alison, if you want to go ahead and provide a brief introduction, just kind of your name, how long you've been an RN, and then what type of facility or unit you work on.
So I am Alison. I've been a nurse for just over 2 years now. And I currently work at a critical access hospital, so pretty rural and small. I'm on the med-surg unit, so we kind of see a bunch of everything.
So how did you apply the concepts covered in the residency program to the area that you work in?
So some of the big things that I took away and applied were time management. So I found like some kind of a tip sheet or like a brain sheet that I put all my patients' information on. And it's kind of organized in a way that makes most sense for me. And that's always in my pocket, so it's always there. And then also I utilize like drop dead times. So things that I know I had to get done, I set times for in my head at least. And then on Epic, there's actually a personal task bar that I've started to utilize and put those drop dead times in there as well. I've also stepped into a preceptor role with new grads as well. So it's always nice seeing kind of the stages of nursing, I guess, the honeymoon, shock, recovery, and knowing how to best help them also through each of those stages.
That's great that you've been able to be a preceptor already. Exciting and scary, I'm sure, at the same time.
A little bit, yeah.
Can you share with us what your professional experience focus was?
Yeah, so at the time of when I did my project, we were kind of in the midst of an increased COVID rise in my facility, and our PPE stations were just horrid. Nothing was standardized in like where anything was, so if you were trying to get quickly into a room, you couldn't. So I kind of just went through and made like a template for how our carts were to be set up. So every drawer, you knew exactly what was in the drawers. And it also served as a reminder to make sure the drawers are stocked. And then I also updated the signage that hangs outside of the room. So it was paper, and we got those laminated into nice looking signs so they can be reused and aren't a risk for carrying more germs and who knows what.
Absolutely. Now, if I remember correctly, with your project, you were kind of looking at something completely different, like getting a cart, and then found that you guys had them, in fact, in your organization. They just weren't being utilized. Is that right? So can you talk about maybe just a little bit like how your project kind of changed based on what the needs were, what you found in your organization?
Yeah, you just said we were looking at carts to use, but then my director already had that planned to some degree. So she had already implemented the carts right at the beginning of my whole project. And I was like, oh gosh, now what do I do? So I had to really sit down and find a way that there was still improvements that could be made, especially with the PPE. I thought it was a really important and relevant kind of thing to be focusing on. So I just kind of sat down and was like looking at the carts over and over again and looking at the whole setup that we have and realizing that none of them ever looked the same. There was no uniformity to any of them, which just made it all harder to enter a room. So I decided to, go down that route.
Yeah, and it worked out great. I just remember talking about that like a couple months in, and you're like, oh my gosh, we already have these. So yeah, definitely wasn't quite the road you were planning to take, but turned out really great anyways for your organization, which was really cool. Awesome. So what did you find to be the most beneficial aspect of the program?
We had the resiliency solution, and I found that super helpful for me. I was going through like some personal tragedy on top of being a new nurse, and I thought the world was ending, and I needed some kind of a way to manage my stress and learn how to bounce back through tough situations. So that was really, for me, the most, I think, essential and beneficial part. Also learning the stages and knowing that I would be going through stages was really helpful.
I think sometimes think that we're trying to scare them when we're like, you're going to go through this, right? It's going to happen. And in new roles, it's going to happen, right? But I think sometimes that knowledge is power, and then you're just kind of expecting it and know you can overcome it too. So that's wonderful. Awesome. Well, anything that you'd like to share with current or future residents?
I guess a couple things, just like don't be afraid to ask questions. There's nurses who have been nurses for 15 years and They ask me questions and I ask them questions. Also to listen to your gut. Your gut knows a lot more than you think it does. And then keeping a journal. It seems really silly, but by the end of that year, you'll still like wonder if you're confident and wonder if you learned anything. And you can like look back on that first month and you're like, wow, yes, I actually did gain knowledge and gain confidence and experience. And then I guess just lastly, you'll get through it. You may seem like you won't, but you will. You'll get through it.
I love it. Awesome, Allison. Thank you so much for your time today. It was so great to see you again, and we'll see you hopefully chat again soon.
Absolutely. Thank you.